Human health impact is becoming the face of climate change. Stop the neglect of neglected tropical diseases. They very often affect marginalized populations to begin with, but we'll see those diseases spreading.
Welcome to The Big Question, the series from Euronews where we answer some of the biggest questions on the world agenda. We're here in Davos, Switzerland at the World Economic Forum, and we're joined by Dr Lutz Hegemann, the President of Global Health and Sustainability at Novartis. So one of the big topics here at Davos this year is climate change. Over the past 20 years, the climate crisis has become more of a crisis and more threatening. What health conditions have we seen become more prevalent across the world?
I think it's fair to say that human health impact is becoming the face of climate change. And of course, we see this predominantly in infectious diseases, vector-borne diseases that had long been eradicated from certain countries. If you take malaria or dengue fever, are on the rise, and there's WHO projection even about the increased number of death cases that we'll see as a consequence of global warming. But then it's not limited to the infectious diseases, but even non-communicable diseases are changing their pattern and increasing in severity. For instance, if you look at respiratory disorders as a consequence of air pollution, but even psychological conditions as a consequence of stress, of noise and exposure. So it's quite broad.
We're seeing a rise in global temperatures. What effect does that have on the body, and what health complications can that lead to long term?
Yeah, for instance, dehydration. It's a major factor that we see as a direct consequence of warming. But I would say the global warming predominantly will manifest itself with a rise and a spread of communicable diseases, vector-borne diseases that will attack patient populations that for many, many years have not lived with a disease like that. And that's what we need to address.
How will they spread more? How is that linked to climate change?
Yeah, that really has to do with the global warming, which opens up new habitats for the mosquitoes, for instance, that carry the disease. You see flooding, for instance, stagnant water is an ideal breeding ground for mosquitoes, as we all know from the summertime. And with these changes, we see, of course, much more favorable conditions for the vectors that carry the disease, and then ultimately that leads to the spread.
Yeah. And so does that include things like neglected tropical diseases? And can you explain a little bit more what are they and why do we need to stop neglecting them?
Neglected tropical diseases is an umbrella term of about 20 diseases that are neglected. And by that we mean they are not necessarily getting the funding that they need. They don't get the attention from researchers. They very often affect marginalized populations to begin with, and that's sort of what constitutes the neglect. But we'll see those diseases spreading, so we have to stop the neglect of neglected tropical diseases, because they will rise in importance, but they are also, for the time being, a very important barrier to making greater progress in global health. And we shouldn't forget that we've made tremendous strides in containing disease over the last 20 years or so. We have halved childhood mortality in sub-Saharan Africa. HIV/AIDS, when I was still practicing as a physician, was a death sentence. It's become now a well manageable, almost chronic disease. So we shouldn't forget about those great advancements that we've seen. But then those are being threatened now by the climate change and the consequences that it has, particularly on the infectious diseases.
Obviously, we've talked about kind of the problems that climate change brings on people's health, but also I think I read an op-ed that you wrote where you talked about, the pharmaceutical industry is kind of in a vicious circle of you're producing medicines to alleviate the effects of climate change, but actually the production of medicine also contributes emissions to the climate crisis. How polluting is the pharmaceutical industry?
Well, the overall healthcare sector contributes about 5% to the global greenhouse gas emissions. That's not just the pharmaceutical industry, but that's hospitals. And hospitals actually are a very significant polluter, despite the great benefits that we all enjoy when we fall sick. But I think we have to make sure that we deliver the positive impact that we want to deliver on humanity through our medicines in the most climate conscious way. And that has led us to adopt climate targets that I would say are fairly ambitious. So we have a net zero target by 2040 for waste reduction. We have almost reduced our waste volume by more than 50% in just a few years. Water quality matters a lot because we need pure water to manufacture high quality medicines. So we have to look holistically, of course, at what can we do to make sure that we deliver our benefit with the minimum impact that we can have.
That brings me to my final question. So if we're looking into the future, and maybe 10 years in the future, how do you see the future of your work?
Yeah, I think climate change is certainly one important factor that exacerbates certain situations, accelerates certain trends, but it's not the only one. I mean, if you look at geopolitical instability, many of the effects on health that I just cited as a consequence of climate change could be potentially triggered by geopolitical changes as well. If you think about the refugee situation, about access to health care, universal health coverage, strength of primary health systems, all of that. If you think about pandemics, I think what's critically important is that we build resilient health systems. And that's predominantly investing in the primary health care, bringing the health care to the patient rather than the patient to the healthcare system. I think we need to stay the course on the elimination of diseases of poverty, very often infectious diseases, because they just have a negative effect on the livelihood of communities. And I think it is actually a shame that we haven't made a lot more progress, despite all the progress that we have made already. So I think the global health area will be exciting, it will be busy, and it's certainly not becoming any less demanding than it was the last 30 years that I was in it.